Understanding that suicide is a preventable problem, communities and states across the country are implementing strategies to address and prevent suicide. I'm Alicia Somji with Prevention Institute, and I'm interviewing Sarah Brummett to learn about Colorado's suicide prevention work, including how the Office of Suicide Prevention has adapted strategies during the COVID-19 pandemic, and tips Sarah has for other states. Sarah is Colorado's Office of Suicide Prevention's director within the Department of Public Health and Environment. Colorado is one of 9 recipients of the Centers for Disease Control and Prevention, or CDC's, Comprehensive Suicide Prevention Grant Program. Thanks for joining me, Sarah.
Thanks for having me.
How do you use the CDC's technical package for suicide prevention work in Colorado?
We've been using the technical package for some time now. It's really a helpful resource to help kind of cross-check our identified priorities and strategies with kind of an existing evidence base to make sure we're on the same track. Um, we really prioritized alignment with the CDC technical package when we were crafting up our comprehensive strategies. Ours kind of fell into different buckets, so the language is a little bit different. We have, 6 pillars that make up the structure of our comprehensive model, and I think the CDC technical package has a few, so we've merged some of them, and then they appear in different ways, but the concepts are all represented. And it was really helpful to have that resource to make sure we are on the right track, that our partners kind of saw that we weren't just pulling these strategies out of nowhere, that they align with kind of this big picture strategy.
And it sounds like by being able to group your strategies into these pillars, it really helps you keep upstream on thinking about prevention and then also still responding to urgent needs.
Yeah, when we're creating kind of the comprehensive model, it has to include kind of activities across that continuum of upstream prevention, intervention supports, and postvention. And so, kind of our 2 main areas that fall in that upstream prevention realm are really around economic stability and supports and community connectedness. And focusing on those really help to create some shared work across different topic areas because we know that those are kind of super protective factors for a lot of negative community outcomes that we're all in silos trying to work on. But this provides us with a place to come together and kind of pool our resources, pool our strategies, and leverage kind of that shared work.
Right. And shared work, I'm guessing, requires infrastructure in place. What kind of infrastructure does Colorado have to really support suicide prevention work?
Yeah, here in Colorado, we have some fairly strong state infrastructure for suicide prevention. We've had an office since 2000 that's received a little bit of general fund funding over the years. We've kept kind of that support from the state. And then in 2014, our state legislature invested in additional infrastructure by creating a suicide prevention commission, which really expanded our office with this external advisory board who helps kind of identify priorities and recommendations to move our state forward. And in addition to the state infrastructure, our priorities now are really about investing in local infrastructure to carry out the strategies of this comprehensive approach. We have to be kind of paralleling what we have at the state level for our local communities because that's where prevention happens. Our job at the state is to get the resources and funding in place and get it to our local partners so that they can do that work.
That makes total sense. You brought up funding right now, and I know Colorado has done a lot of work in terms of braiding and blending funding at a state level. So just wondering, how have you kind of gone about that?
Yeah, unfortunately, as you know, there's no one single funding source that's large enough to fund a fully comprehensive model. And so we've had to really braid our funding streams to create as many leverage points as possible. So, some of our local communities are really braiding their funding from a variety of topic areas to have this full comprehensive approach. So one of our communities has co-funded their coordinator position with a grant program from our department focusing on preventing child maltreatment. And those strategies are also looking at building economic security and stability for families. And so it aligns really nicely with our work around comprehensive suicide prevention in that upstream realm. And so we're trying to eliminate barriers at the state level for what our local partners are able to pool together, knowing that we haven't reached that tipping point yet for full funding. We've got a lot of funding here in Colorado, and I feel very lucky that we do have access to it. But we're still not at that point where we can do full comprehensive work in every county in Colorado to the extent that we need.
And being able to braid and blend that funding helps in addressing multiple issues, as you said. And I think that example of the child maltreatment work that's going on and thinking about suicide prevention together is a great example.
Yeah, it's been really helpful kind of uniting our branch as well. So here at the Public Health Department, I sit in the Violence and Injury Prevention Mental Health Promotion branch, which is a mouthful. But we have topic areas covering, child maltreatment prevention, overdose prevention, motor vehicle fatality prevention, suicide prevention, interpersonal violence, sexual violence, all of these things that we know share protective factors. And that's really given us some common language to identify ways we can work together and break down some of those silos that we know exist.
So it sounds like you had a lot of relationships in place, policies that allowed the Office of Suicide Prevention to be in place. But I also know COVID-19 has created a lot of challenges in the work that was already happening in communities. So I'm curious, how has the office adapted during the pandemic?
Yeah, it's been a lot, and we've had to pivot a few things. But I think kind of our modest early beginnings really required us to form those relationships with local organizations and be innovative, because in our early days we didn't have that large funding bucket that we have access to now. And so it really required us to form and build and maintain those relationships. um, and beginning a few years ago, we started being able to fund that local infrastructure that I was talking about. And what we saw in our communities where we had some dedicated resources, some dedicated staff who was really focused on building that community engagement piece, they kind of had a safety network built when COVID happened and everyone was transitioning to virtual and remote and all of those things, so that their community had someone to reach out to for resources and information and materials and things like that to help navigate from a community perspective this new kind of situation that we find ourselves in. Um, and I think that was really, really helpful for a lot of our communities to have that protected resource um, of a person who was kind of dedicated to the work.
And COVID-19 has definitely affected some of those risk and protective factors in communities, whether it's things like social isolation or, thinking about economic security. So what's been kind of coming up in the communities in Colorado in terms of focuses in addressing risk and protective factors?
Yeah, I think whereas before, um, it was sometimes a harder sell for us to get folks on board with the upstream prevention around economic stability and support. But now I think most folks are kind of on the same page that we know this is a big risk factor um, in our communities that's affecting a lot more people. And so it's helped to bring additional partners to the table and kind of cross pollinate those strategies. So we're not asking our suicide prevention professionals to become economic stability and housing security experts, but we're really forming the connections between the two worlds to help kind of leverage on both ends of that. And so some of our community organizations are now partnering with um, food security systems where local agricultural producers need to get their food out and without restaurants having the same demand for regular food. A lot of our farmers have this surplus that they don't have places to store it. And so some of our coalitions are helping to navigate those networks to make sure that the food is feeding people in communities that need it and that it's available. So we're seeing some really cool, innovative um, partnerships rising up in the economic stability realm, and that would include, housing, affordable housing, food security, access to quality, affordable childcare, livable wages, family-friendly workplace policies, things like that that were important before, and we knew were important for suicide prevention before, but more and more folks are coming to realize just how important they are when more people have those kind of security elements a little bit more tenuous.
That's really exciting that there's progress being made in those kinds of areas. And I'm looking forward to keeping connected with the work that's going in Colorado and really continuing to learn from you. In terms of kind of your recommendations, tips for other communities and states, is there anything you'd like to share?
Gosh, I think the big thing is recognizing that this takes time. Comprehensive suicide prevention, getting the building blocks together. This is a long-term community-based approach. We're building and investing in communities to make them worth living in rather than simply focusing on keeping people alive or delaying death. It's kind of a paradigm shift that suicide prevention needs to be more than just preventing people from dying. And I think keeping that at the forefront and remembering that that's the goal, is to support communities and take a step back from that traditional approach, which really siloed the efforts, I think is important.
I also really like how you were sharing earlier that folks working in suicide prevention don't need to become experts in things like housing or economic security, but really building those bridges and alliances with those already working in those areas. I think that's really important.
Absolutely. It's important to remember that this work is happening. I think our role as suicide prevention folks is to help amplify that effect in communities. And so joining forces and coordinating activities so that we're cross-pollinating across across those sectors is really important and exciting to see.
Well, thank you so much for joining me today, Sarah.
Of course, thanks for having me.